Brought to you by ExpressCare Health and Skin Center. Get in, get out, get better.
Welcome back to Healthy Living. Sneezing, coughing, and blinking are simple reflexes that you may not even consider are reflexes. They are involuntary actions or movements that occur in response to a stimulus. Here to tell us more about reflexes as well as the funny bone and why they even call it that is ExpressCare's Dr. Jitka Lom. Thanks so much for coming in, Doc.
Nice to see you.
Right before the holidays. So what causes a reflex, and what, you know, I named a couple of them, but what are their function?
Right. So, you know, like you explained, reflexes are involuntary actions. It means we don't have to think about them, they just happen. And many of them we're actually born with. Nature has put them in our body as a protective mechanism. So you mentioned the blinking reflex. If something just comes by your eye, just almost touches your eye, you will instantaneously blink and you will have a withdrawal reflex too, because you want to protect your eyesight. This is not something that you have to be taught or trained in, it just happens. Babies are born with a number of reflexes also. That, for example, a grasp reflex, if you just put your hand here, a baby will grip you. A sucking reflex. We're all born with a gag reflex where you know, we'll choke or gag if something's tickling the back of our throat. So these are things that we're born with, and they're all ways of our body protecting us, ourselves, ensuring our survival. And this is something that's really quite amazing when you think about it, because it happens faster than you can possibly even think. You cannot control it. It happens extremely quickly.
Just like breathing and blinking.
Right.
So now, why do doctors check for it? I think that's the first thing I remember as a kid, is going to the doctor's office and they hit you and they hit your knee.
They tap your knee, that's right. So we check the reflexes. Those are called the peripheral or the deep tendon reflexes when you tap the knee or the elbow here. Because that tells us a lot about the nervous system. If you have a normal reflex in your knee and your elbow, it means that probably brain's okay. All the nerves going down to your fingers and toes are fine also. Other reflexes we might check again with the blinking, gag reflex. Babies, we always check all their reflexes to make sure that babies are born healthy.
Now, what happens if somebody's leg doesn't move or their arm doesn't move when you do that test?
If they don't have a reflex, or especially if you're matching sides or checking the two sides and one side isn't and the other is, then there is a problem with the nervous system. In general, not always, but in general, if there's a very slow reflex or an absent reflex, then it tells us that there's something wrong with the nervous system, with the nerves in the periphery, meaning all the extensions of the nerves going down. Whereas if the reflexes are very quick, some people have extremely very rapid and brisk reflexes. This can be a more central problem, meaning there's a problem in the brain, or a metabolism problem, for example, thyroid and so on, can accelerate your reflexes.
Okay, so how you talked a little bit about how reflexes protect us, and so I wanted to talk a little bit about the funny bone. That was actually kind of what prompted this topic. Is I was doing something and I hit my funny bone, and it was not funny.
Right.
So I was doing some research, and the funny bone is actually not a bone.
It's not even a bone, and it's not funny. The word funny is meant in the word in this sort of meaning of strange or unusual, because when you bump your funny bone, which is here at the elbow, you'll get a weird tingling and almost numbness, and sometimes even weakness if you hit it hard enough. What you're actually hitting is something called the ulnar nerve. That's a nerve that comes from your neck down your arm and twists right around your elbow here in a little groove, and it's a little bit exposed there. So if you bump it on something, you're actually bumping a nerve, and that is the feeling of nerve pain that you're experiencing, and the numbness and tingling and weakness of actually damage to a nerve. Thankfully, most of the time this damage is very minor, and 4 or 5 minutes later you'll be feeling okay, but occasionally people actually can pinch that nerve in that area and then have that feeling continuously. You can imagine how unpleasant that would be.
Okay, wow. So coughing is a reflex as well?
Coughing can be a reflex, yeah. One I like to think about is if your eardrum is irritated, you will have a cough reflex. You can also have a cough reflex from stimuli, meaning like if there's something that comes in the air, there's some kind of pollutant, you'll cough.
Okay, now I wanted to ask, is twitching, muscle twitches, are these a reflex, or what are those? What's the difference?
Not generally. Twitching of the muscle, again, it is an involuntary movement, but it's not necessarily sort of a one that's reproducible, like it is with reflexes, or one that's consistent. Sometimes muscles will just do their own thing.
Right.
Sometimes people have an eye twitch when they're very stressed out, or their leg will jerk or twitch, but these are not reflexes. They are involuntary actions, though.
Okay, and so is there a way to build your reflexes?
Well, this is an interesting thing. These reflexes that we've been talking about, these are inborn, and they are there. We can control them with our mind. For example, if you go to the doctor and they tap your knee and it's not working, they'll usually ask you to close your eyes or look in the other direction, because then your conscious mind will not be able to interfere, and you will just go ahead and have your normal reflex. So you can control the reflexes to make them either be absent, or sort of, if somebody says don't blink and you're focusing and you make it not blink. But you can't really improve them. When we talk about improving your reflexes, like for example when you're driving, we're talking about conditioning your body's habits and reactions, but we're not talking about something that's inborn or that you're naturally equipped with. So reflexes, as far as like getting good at tennis or driving, braking quickly, these type of things are habits and skills that you can develop, and we call them, in layman's terms, we call them reflexes, or it's just a reflex now to do whatever it is that you do that you've learned, but that's a learned habit.
Not necessarily a reflex that
Right.